Hello, Fit Fam, and welcome to another episode of the Fit Doc Podcast. As you know, in this podcast, we discuss how to stay mentally fit and physically strong, how to navigate the life challenges, and also to conquer every challenge that comes along your way. We have great experts covering topics that you care about, you've asked about, and we're going to talk about current health and wellness trends and really how and why to implement wellness into your daily routine. Today, we are going to talk about your heart health. It's a really special episode because it was recorded in front of a live studio audience during a partnership that I have with the Long Island Nets. The Long Island Nets is a great organization that brings not only basketball and education, but the education of your health and wellness to the community. So by partnering with them, I hope that we expose our community to more wellness topics so we can all live our best and most healthiest lives. Today's episode, Dr. Sonia Henry, who's a cardiologist, is going to discuss the importance of your heart health as she brings in a total wellness approach. And we'll also discuss how to take care of your heart. Stress, eating habits, and exercise all impart a major role in your heart's health. But before we talk to Dr. Henry, let's talk about today's hot topic. So recently, there was a football player that we all know now, Damar Hamlin, who was injured and had an episode where he went into cardiac arrest, where his heart stopped while he was playing football after he took a hit to the chest. He was resuscitated on the field by first responders, but this also shows us how fragile and delicate our heart can be, even though it's a muscle. And it also shows us the importance of knowing CPR ourselves, so that way, in case we have an emergency, we know how to respond. But thank God he is back, and he's not back on the field yet, but he is out walking and talking. So one of the things that I like to do every day is starting my day with meditation and prayer. So in order for us to be mentally fit, that is one of the things that we need to learn to incorporate, how to meditate, to pray, because when we do that, it helps to calm down the nervous system. It helps to clear our mind of any type of negative thoughts, because if you learn, you can't have a positive and a negative thought at the same time. And as you clear out your head, it helps you to think about different problems that you need to solve. And it's also a good way to set your goals and your attention for the day. Some find that as you speak to a higher power, it helps to lower your stress level. It also helps to make you a little more focused, and prayer helps to give you a sense of gratitude. Now, on to our discussion with Dr. Sonia Henry. Hello, Fit Fam, and welcome to the second Fit Doc Wellness Seminar with the Long Island Nets. I am Dr. Michelle Reed, and I'm going to be talking to you about everything that pertains to your health and your wellness, because I want us all to be healthy. I am so excited about this partnership that I have with the Next, because it gives me the opportunity to not only share and to live my best life, but it also gives me the opportunity to make sure that my patients, my family, my friends, and all of your family and friends can stay healthy as we go along this journey together. I am a board certified family practice physician, a certified personal trainer, a health coach, and a best-selling author of a book, Mentally Fit, Physically Strong, the Fit Doc's Guide to Real Life, Real Fitness, and Real Health. That was released in May of 2017. And yes, I am working on another book, and that too will be an Amazon bestseller too. So today, my goal is to make sure that I inspire you, motivate you, and keep you going in all aspects of your health. And for February, we are talking about your heart. So today, some of us are going to be wearing red, and we're going to take this opportunity to talk about the health of your heart, in addition to other things too.
Absolutely.
Yes. So today, my amazing guest is none other than Sonia Henry. She is a cardiologist with North Shore Hospital, really the Northwell systems now, and you are director of Echo for them. So it is indeed an honor, and I'm so excited to have you here with me today.
Oh my God, thank you so much for having me here, especially in Heart Month. I'm so happy to talk about cardiology today and really talk about any questions you have regarding to cardiology.
Okay, so before we get started, I have a question for you.
Absolutely.
Everybody knows things about what you do, but what is a fun fact that we might not know about you?
Ooh, that's a great question. Well, there's a lot of fun facts, but
Just one.
one. Well, a lot of people don't know about me that I'm a black belt. I trained for 16 years and earned a black belt. I was a teacher, so I'm not practicing as much now because work is busy and being a mom. But that's a fun fact about me growing up.
Wow.
Yeah.
So thank you. I didn't even know that. I've known you for maybe about close to 10 years probably.
Yeah.
All right, so we're going to jump in. I guess some of the questions that I have and what other people have been saying is, how do you maintain a healthy heart? And I know sometimes we talk about heart disease, we talk about hypertension. So if you could just start right in, because I need to make sure we cover some ground and make sure everyone gets educated.
Absolutely. Well, I think it's important to start initially to talk about what cardiology is before we delve into the details. Cardiovascular system, it sounds, a little scary, but, I think it's important to think about the heart. It's a small organ that sits in the chest. It's about the size of your fist. And it's really a specialized organ that really encompasses the heart muscle itself, which can be damaged from a heart attack, but also hypertension risk factors. There's valves that are in the heart that control blood flow. We have the blood vessels, which supply the blood and can be clogged up with high cholesterol. And then, of course, the electrical system of the heart, which can cause arrhythmias and palpitations. But it's really important to not forget that the big vessels that come off of the heart, it really is the arteries, exactly. That is so important, right? Because that perfuses your entire body. And so the cardiovascular system is not just the heart, it's really all the blood vessels in the entire body, including your brain and your kidneys, right? So that's really important to start with.
That was a mouthful.
Yes.
So I hope everyone got that. But we're definitely going to make sure that you see it on the replay and you can play it over, because that in itself is a lot.
It is a lot.
And that's why I wanted you to come on, because I know that you will be able to explain things to people in a way that sometimes, they're not going to be walking out of that office coming to me and saying, Dr. Reed, you sent me to see Dr. So-and-so. And I don't understand a word that they said to me, because you always take the time to make sure people understand. So thank you for that introduction. So let's just jump right in.
Absolutely. So in terms of the things you mentioned, risk factors, I think it's important, and you said talking to patients really about the details of those risk factors. Are you guys aware of your cardiovascular risk factors? So the common risk factors are high blood pressure, perfect, hypertension, which is called hypertension, high cholesterol, diabetes, smoking, right, not exercising, and also the family history. I think it's really important to also mention the emerging risk factors a lot of people are not aware of. Really anything that causes inflammation. So, I'm gonna tell you some things that you may not be aware of, but you should bring it up if you know somebody, with your physician or yourself. So lupus and rheumatoid arthritis increases your cardiovascular risk 5 to 8-fold, right? So if you've had also pregnancy complications, hypertension, diabetes in your pregnancy, that's going to increase your risk. Obstructive sleep apnea, breathing issues, right? So that is actually going to increase your risk for strokes and hypertension.
Now, can you explain why that is the case?
Sure.
Because a lot of times I'll, say to a patient, well, do you snore? And they say, yeah, I do. And do you ever gasp and just wake up when you're sleeping? Yeah, I do.
Yes.
Well, you know what? More than likely you probably have sleep apnea. Oh, and then you try and explain it to them about the relationship with the heart and sudden death. I want to hear from the cardiologist.
So what happens is that when you are, snoring, and essentially you're blocking your airway, and the risk is increased with obesity and increased neck size, and what you're causing is your blood saturation, which normally is 100%, to drop down typically into the 80s. Too low for the body, and essentially your arteries start to increase the blood pressure to provide more blood flow. The arteries get stiffer, so it increases your risk for hypertension. It increases your risk for strokes, because if the pressure is going up in your brain, you're going to have increased risk for stroke, because over time, blood vessels start to change when the hypertension is high. So if you, back to the original question, if you do have family members who snore or have obstructive sleep apnea, they need to be diagnosed and they should be treated. You know, it's a mask that you have to wear. They have some new devices that really help, but that's going to, decrease your cardiovascular risk.
Yes.
So I think it's really important. Other risk factors, just to kind of complete the list, is cancer-related treatment, radiation, and also chemotherapies are really important because you can have cardiovascular complications from them. And lastly, I don't want to not mention depression. Depression is a big risk factor. It increases your risk for heart disease 2 times. So again, another mouthful, but I wanted you to hear all of the risk factors for cardiovascular disease in Heart Month.
So now, what exactly is hypertension?
So yeah, we talked a little bit about that. Hypertension is essentially when the pressure in your blood vessels are too high. What does that mean? It means that it's too high for the organs, your brain, for your kidneys, for your heart. So let's think about that. So what is the definition of hypertension? Is if the blood pressure is greater than 120/80. It sounds kind of strange. A lot of patients will ask me, 120? I thought that was normal. Well, actually, that's pre-hypertensive. The reason the numbers kind of changed from 130 was because we recognize that folks in that early range, 120/80, are developing heart disease as well. So you need to really make sure that your pressure is lower than that. Too low.
So let me just ask you a question. So if we say 120/80, does it matter what age that person is? Because 120/80 in someone who's like 24, 25, as opposed to someone who is 67, 68.
Absolutely. Great
question. What is the difference between the two?
So, normal blood pressure is really 100 to 120. But as you age, so if you are a hypertensive patient, with long-standing hypertension, that cutoff may be too low for you.
Okay.
So, so we really gauge this question to the patient specifically. Typically, a diabetic patient, for example, we like their blood pressure 130/80. So anything, at minimum 130. So again, it's really dependent on the patient's symptoms and their current risk factors. But globally, for all patients, the cutoff pre-hypertension is 120. And I think it's, something that, to discuss with your doctors. The treatment for hypertension is not really on one blood pressure draw. It's really, we watch you over the course of a few weeks, up to 8 weeks, essentially. And if your blood pressure is consistently above 130 or 140, then you get medication. So it's not something that we start. But hypertension is something that can cause damage to the arteries, specifically the heart. With the high blood pressure, think about your own muscles. If you, add weight, if you're lifting weights, what's going to happen to your muscle, your biceps?
It's going to get bigger.
It's going to get bigger, exactly. And so same exact thing is happening to your heart. If your heart is under pressure, it's going to start to enlarge. So a lot of people with hypertension have an enlarged heart or concentric myopathy, a thickened heart muscle. Same thing with the kidneys. High blood pressure in the kidneys is going to start to damage those cells and lead eventually, if it's really uncontrolled, to dialysis. So the pressure in our organs really needs to be at a normal level to not prevent disease.
So if someone is diagnosed with hypertension, how often should they see the cardiologist, and how often should they have blood work? Because what we normally do is we'll do blood work to check their kidney function, to make sure their kidney is functioning fine, because we don't want anyone going to stage 5, because once you get to stage 5, that is end-stage renal disease.
Absolutely. So important. So I think it really depends on where you are with that blood pressure. I think if you are very uncontrolled, you need to see the physician often, maybe in the first 2 weeks after starting on medication potentially. I think routinely every 3 months initially to really regulate your blood pressure. Once you start medications, you really need the blood pressure medication to marinate in your system. It takes a few weeks to really get in there. So it's important not to skip medications and really work with the physician to make sure that number is coming down. So the only other thing I would say is you talked about monitoring. You can get your own blood pressure machine at home.
So what about those ones where you put on your wrist instead of up your arm? The ones on the wrist, how are those?
The ones on the wrist are fine. If you can tolerate that, if you can get it at the pharmacy, they're pretty cheap these days. Yeah, absolutely. It's a great way to track your blood pressure. And you can bring it into the office and check your blood pressure and correlate it to your doctor's blood pressure to make sure it's accurate. So really important to...
So you don't have a preference between your wrist and your upper arm?
I mean, the preference is the upper arm, but I would say if you have your hands on something, you should use it.
Okay. So whatever you have, it's better to use whatever you have as opposed to
Yeah.
not doing anything at all.
Absolutely. The other thing is blood pressure monitoring should really be done in the morning. You know, you should be seated and relaxed. You should probably throw out that first blood pressure. A lot of people have anxiety in the first blood pressure reading, but it's the second one you want to report to the physician so that they can titrate medications, change it with you. And the other thing is diet, right? Diet is super important. So, you know, as we know, hypertension is increased with sodium intake, and, you know, all of our diets really, the American diet in general, the Caribbean, the Hispanic diet, very high in salt content. So it's really important to regulate your salt content to make sure that that is low. And the number that for a goal is less than 1,500 milligrams, about 12 to 1,600 milligrams a day.
Okay. And now before we wrap up, one final question. What role does exercise, because you know I'm Fit Doc, so Fit Doc always has to talk about the benefits of exercise. So what's the benefit of exercising with your cardiovascular system?
Absolutely. No, I love that question. It's really important. So the heart, again, is an organ. It has to be exercised. Think about any muscle in your body. And if you don't exercise, the heart will decondition. So exercise is important for stamina. For, you know, think about the time you need to run. You know, you need your heart to be, you know, in shape, essentially. So that's one benefit, right? Second benefit, it keeps your weight in check. You know, and it actually regulates your blood pressure. If you are exercising, your blood pressure is actually more regulated with blood pressure. And of course, exercise, you know, it causes endorphins to increase in your body and makes you happy, decreases depression, which I mentioned to you.
Another risk factor.
Yeah, another risk factor. So really, you know, exercise and the work you're doing is really important for heart health.
My question deals with the NFL player Damar Hamlin. I don't know how many people saw it, but I had an opportunity to watch it with my family live, and it was a very scary situation to watch the Buffalo Bills safety go down. And if you could just talk a little bit about that as a father, as a parent, love sports, but this seems to be a sports-related type injury. If you could, I don't even remember what the name of the effect that he had, but it was, you know, it was pretty traumatic. And if you could just talk about that, because I think it's relevant to parents.
Yeah. I mean, that was a very scary event. And, you know, the great thing was that the health team responded immediately. When somebody goes down and is having a cardiac arrest, we say time is muscle. You need to emergently intervene in that patient and get their heart back into normal rhythm. So, you know, what he suffered was a cardiac arrest, and specifically with him, he didn't have any cardiovascular risk factors. But, you know, he did suffer a blow to the chest. And so essentially, you know, if you hit the heart at specific timing, there's a very, very small window, a chance where you can actually intervene into the electrical circuit of the heart, which I mentioned to you before, and cause the heart to have ventricular tachycardia or ventricular fibrillation. It is actually very rare. You know, the specific, what the theory is that happened to him, that the blow, you know, the hit to the heart, whether he fell or, you know, in the interaction in the play, was really, you know, that specific timing in the cardiac cycle that caused it. So really, you know, it sort of was a little bit of a fluke. I mean, he is undergoing, you know, genetic testing. He's undergoing cardiac MRIs and specific cardiovascular testing to look for other things that may not have been visible. But nothing has come up so far, you know, in terms of what they've shared.
Even checking for what you mentioned before, autoimmune diseases, because that is a risk factor, the lupus,
Absolutely.
the scleroderma,
Yeah.
the sarcoidosis, things like that.
So for sports, you know, it's really important for kids to really have a cardiovascular checkup before they start sports, and all of our sports athletes do that. They have thorough athletes. For your own kids, if they're going to be doing active sports, it's really important for them to get a health checkup from their physician and an EKG to start these physical sports.
Thank you. I have two questions.
Sure.
When you're exercising, you're running, what's the correct way to breathe? In through your nose, out through your mouth, or just breathe?
No, that's a good question. So yeah, I mean, a lot of people. I mean, Dr. Reed could probably speak to this more. As runners, sometimes it's easier to breathe in through your nose and out through the mouth to really maintain stamina. I hear a lot of runners say that specifically. It doesn't really relate to your cardiovascular health specifically.
Yeah, it's just whatever feels more comfortable and more natural to you.
My second question, I take my blood pressure all the time. Sometimes I take it in my left arm, it's okay. I take it in my right arm and it's maybe 10 points better, higher. What
causes that?
Yes.
Yeah, I mean, that's a great question. Sometimes the vessels essentially around the body are different. So if the blood pressure, for example, it's something you should probably follow up your physician with to get some vascular checks. But, sometimes the size of the arteries are a little bit different and can cause a slight change in your blood pressure. 10 points is not considered significant, but if it's certainly more than that, I would say that it's something that you require an ultrasound to just make sure there's no narrowing or blockages in the arteries that supply the arms.
So Dr. Henry, thank you so much for coming by for Heart Health Month with all your information. And what we're going to do is we're going to post how people can reach out and get in contact with you and even make an appointment to see you.
Absolutely. Thank you so much. It was a pleasure.
Thank you.
Fit Fam, today we talked about how important your heart is and your health, along with how to lower your stress through meditation. Damar Hamlin has really inspired us to continue to make sure that we stay healthy and also to learn CPR because it does help to save lives. Every second counts. Your heart is one of the most important organs of your body, and we need to learn how to take care of it. Until next time, make sure you share this podcast with people that you know as we learn how to stay healthy together.